And this is a huge issue, of course, here. So let's bring in Dr. Richard Kang. He is he's going to talk to us more about the reopening of schools.
Yeah, Dr. Kang is a director of pediatrics intensive care at Dignity Health Northridge Hospital. Thank you so much for your time, doctor. I'm curious what you are hearing from parents in your office. Are they eager to get their kids back in that classroom?
Yeah, I think most parents are eager to have their children back in the classroom just because of all the things that the children are missing. But everyone still wants to be sure that the schools are prepared to handle in-person learning and that the safety protocols are in place.
Yeah, the safety protocols, that's the big issue. You know, how much of those safety protocols are necessary, doctor? I mean, the teachers union really wants all teachers to be vaccinated fully before bringing back to schools. But have we learned any lessons from other school districts, let's say across the country? Do you think it's necessary to have every single school teacher vaccinated before they fully reopen these schools?
Well, I think one of the things, like all the measures that we've talked about and the ones you've outlined earlier, are to decrease any chance of transmission. We know that the more the virus is transmitted, the more chance that it can mutate and form other variants. And I think that's the issue at hand. I know in other states or even other counties that schools have opened, they've had a very strict guidance of if there is either a close contact or a person that does contract COVID, that they do really serious contact tracing and try to limit really the transmission within the school. In those places. So I mean, I personally am a believer in vaccinations, and the more teachers and if all teachers could be vaccinated, it definitely would help decrease the rate of transmission and also decrease the rate of illness and hospitalizations. As we know, children are less likely to transmit the disease, but they're also more likely to be asymptomatic in carrying the virus. So I think that's the concern among teachers going back and trying to, you know, I think all teachers that I've spoken to want in-person classes again. And I think, you know, they just want to make sure that they're protected as well.
And what's your take on the CDC considering those color-coded zones that we just talked about? Were you familiar with that?
Right. So again, yeah, as you mentioned, what was it? The blue and yellow being they would recommend, and that's a very low rate of disease in those communities. And again, as long as the schools are prepared and they practice those safety protocols, you know, I think it's a step forward in bringing kids back into the classroom.
Yeah. It certainly will be a step forward, and certainly we hope that more and more teachers, more educators will become vaccinated so we can bring things back to normal and get our kids back to school. Dr. Kang, thank you so much for your time. We appreciate it.
All right, thank you.
Thanks, Dr. Kang.